Pretty interesting, huh? Well, joining me in the studio right now is San Francisco ophthalmologist Dr. Lillie Mosaddegh. Now, she has treated patients with this new technology. And Dr. Mosaddegh, thank you for being here.
Absolutely, sure.
Full disclosure here, I have had this procedure done by your office on one eye to see because I have a terrible dry eye problem and I don't have enough tears. And so your office has given me a lot of advice. It's just a really comprehensive program. So one thing doesn't just fix it. What causes dry eye?
You know, chronic dry eyes, just by as the name implies, it's a long-term process. So because it doesn't appear overnight, it doesn't disappear overnight. And there is no one remedy that fixes everything. And dry eyes come in, different categories, and the treatment according to that could be different things.
Now, we're looking at some animation your office provided to us. We're looking at the red eyes. I can relate to that. And this is from Tear Science Video. So this is one of the indicators, right?
Well, people with dry eyes could get redness. They can have foreign body sensation in the eyes. The eye could be uncomfortable, and sometimes it's even hard for them to focus.
And it looks like a fingertip pressing on the eye and looking at the glands there.
Well, the meibomian glands, these are oil glands inside the human lid, and they produce the oily part of the tear, which is essential to keep the liquid part of the tear from evaporating.
Is there one person who is more likely to have a dry eye condition than another?
We are seeing dry eyes across the ages and in different occupations. Of course, this being the computer age, as people are staring at the monitors longer, we're seeing that they're dealing with dry eyes at a younger age. People who suffer from diseases like rosacea, their glands are affected because of that disease process, so it's a skin problem that affects the eyes. The baby boomers are dealing with dryness. Some of it is aging, and some of it basically is hormonal, like, pre- and postmenopausal women are having problems with hormonal stimulation of their oil production.
And young kids too, right?
Kids could have dry eyes these days also because of the environmental factors and the chemicals their eyes could be exposed to, especially the ones who deal with, swimming and other things. So
and they're on the computer a lot.
The computers are
Video
here
games.
to stay, and we have to treat the eyes so that they can, be healthy as they're looking at the computers.
Right, so you put me on a lot of different things. So can you list those for people and all the things that you think could help? Well,
let's start by talking about dry eyes just briefly. Dry eyes is a general term that actually contains a lot of different categories. If we want to just simplify things, some dry eyes are a volume problem where the eye doesn't produce enough tears. But the other category is where people come in and say, I'm tearing all the time, and we tell them they have dry eyes, and they look at us like, did you hear me? I just said, consistency of the tears is important. It's not just the volume. And if you don't have enough, it's like a salad dressing. If you don't have enough of every ingredient, it doesn't work. And the human tear film has the oily part that gets produced by the meibomian glands. It has the liquid part. It has the mucin part. And if you don't have enough of everything, just volume doesn't work. So when you want to treat dry eyes, you have to have a way of analyzing the patient and the patient's eyes and seeing which one of these problems are the underlying cause, and then go at that cause.
I know that for me, it took a lot, or it's taking a lot. So, and it includes Restasis and supplements.
As I'm looking at your eyes, I'm actually very proud of what we've done. You look beautiful, and the eyes look great. We have to basically put you on medications that stimulates normal tear production, and then supplement that with nutritional supplements, with the new technology that's available to kind of hit this problem, because it's a multifactorial problem. So we have to hit it from all directions.
All right, Dr. Mosaddegh, thank you so much.
My pleasure.
I appreciate all the help, and I'm sure folks at home do too. We do have to take a break. When we come back, we're going to hear from one of the Bay Area's top experts on the leading disease that causes vision loss in older adults, macular degeneration. Stay with us. We'll be right back.